antibiotic عادي. Oh, you go every
Yes. Yes.
Yeah.
I try to put myself like, and we spoke about congenital heart disease. Where is my flash?
No, you should put the flash and it will be here.
Okay, welcome to new students and also to the vocal. I was a problem when the vocal is hand. He is responsible for absent. Who is?
Everyone. Everyone is responsible for himself.
Okay, we spoke about congenital heart disease. Okay?
Yep.
You can go fast review and go to the continuing.
Okay.
We said about congenital heart disease. This subject is too important for you as a nurse. And we said about that is the second cause of death in neonates after prematurity, and we said about that detect is soon and in the first week and first month after birth. We said about the cause and said that genetic is the first and unknown, and we said about factors, about drugs, about some diabetes, genetic, and some infection. Rubella led to that. And I said about the age of pregnancy that is very important for heart disease. Also about some external and environmental. Please read them in the file. And also about method of diagnosis, and for confirming we said about angiography, that is very important, and echocardiography. And this is a boy with congenital heart disease and is in under surgery. And we said about family history, about signs, symptoms, and also physical examination, and about blood pressure also. And this is normal vital sign, let's pay attention to them. And about pulses, checking pulses, about trees, precordium, apex beat. This was about hepatomegaly, and this is about murmurs that say, listen carefully. And what was this? Puzzle. Come here. How are you? What's up? You were absent. Yes? Right. What is this? What? Pulse oximeter, that is. And also echocardiography we do, and this is Doppler. That is a kind of sonography for detecting. It was chest X-ray. You can see what? Cardiomegaly.
Large heart.
Yes, cardiomegaly, and that was we went about fetus circulation and about PDA. Look at them. We said about cyanotic and acyanotic. Do you have any question? No? Okay. And I will say. This session we spoke. Blue baby is cyanotic. And acyanotic, we said about BSD, ASD, and PDA. This was cyanosis in the fingers. Okay, we said about ASD. What was ASD?
Arterial
Arterial septal defect.
You can see in this picture ASD and 3 types of ASD we have. What kind is this? Secondum. It's the middle, you see? This is secondum. This is osteoprimum. And this is secondum. This is sinus venosus we spoke. And what is this? Primum, osteoprimum. We spoke about them and go to, what was it? This was ASD, a large ASD from this part to this part, that is too large. And we spoke about umbrella used for ASD and BSD to closing. This is surgery. And we also spoke about BSD, okay? Ventricular septal defect. And that was BSD. More than one BSD in this picture you can see. And about treatment, I said also umbrella. And we spoke about PDA again. Is it clear? Yes. PDA between aorta and pulmonary artery. And the treatment was like, what the name of the drugs? Endomethacin in IV form. We didn't have in Iran. Maybe you have in Basra. If it is, inject as soon as possible to the neonates for closing the PDA. If not closed, it's necessary to cut it and neurosurgery, heart surgery. Okay. Ligation. The surgical is ligation. Ligation, 2 parts and cut between them. Okay. That was clear?
Yeah.
Okay. We wanted to go to cyanotic disorders. Okay. In cyanotic, we have cyanosis. The most important disease is tetralogy of Fallot. Tetra means 4, and Fallot is the name of a doctor that introduced this disease to the world. Because of it, its name is tetralogy of Fallot. Okay, clear? In tetralogy Fallot, we have 4 defects. That is final exam question. Okay, tetralogy of Fallot. We have 4 defects. Mahdi, do you read them, these defects? Number 1 in the picture. Number 1. Come here and read them. You see? Come here. Come here and say to me, what are these 4 defects in the heart? In one baby, in one heart, you have 4 defects. Number 1, Mahdi.
Pulmonic stenosis.
Pulmonic stenosis. What is mean? Pulmonary artery stenosis means Mahdi.
It means the valve will have.
This is pulmonary artery. This is stenosis. Okay, you see it? Narrowing in the pulmonary artery. This is pulmonary artery. This is stenosis. The flow of the lung is increased or decreased? Decreased. That is a cyanotic disorder. Because of. Number 2. Mahdi, number 2.
Right ventricular hypertrophy. Enlargement in the.
Why?
Because of the narrowing of the pulmonary stenosis. So it's have to do more.
Stenosis in the right.
Yeah.
Okay, led to hypertrophy of the right.
Yeah.
Are you agree?
Yes.
What about the left?
I will say, pay attention. Number 3,
Ventricular septal defect.
you have a defect between 2 ventricles.
Yeah.
Number 4,
Overriding aorta.
overriding of aorta means aorta's place is in this place, on the VSD place. Do you find it? This is a cyanotic disease of heart. Why? Why not unknown or genetic?
Because not enough blood is being pumped out.
You have a stenosis. The blood wanted to go to pulmonary artery, but it couldn't come back to the ventricle right and led to hypertrophy.
What is
Okay.
the cause?
What?
The cause of
A stenosis.
No, the cause, is it genetic or unknown?
Like all of heart disease that I said to you. Drugs, cigarette, age, all of that risk factor is stay for these 2. Okay?
So why is compound pulmonary stenosis compound with BSD?
Why? This is congenital. This is congenital. Unknown. We didn't know why these 4 defects happen. Congenitally, genetic, drugs, all of risk factors that I spoke about are responsible. This is a fatal congenital heart disease. Many of them may death, expire. Okay, do you find it? This is tetralogy of Fallot. Fallot is the name of the scientist that introduced this disease, and these patients have 4 defects. Number 1, what? Pulmonic stenosis. Number 2, right ventricular hypertrophy. And number 3, overriding of aorta and VSD. Okay, it is clear?
Yeah, it's clear.
Hypertrophies happen in right. Why? Because of stenosis.
And we have a left ventricle.
Yes, we have a VSD.
Yes.
The pressure on left is more, comes to this, right. And you have a stenosis also. You have more pressure in the right. And the right, you have right ventricle hypertrophy. Okay? Children with tetralogy of Fallot exhibit bluish skin during episode of crying or feeding. Sometimes, all of time, they are bluish. They are cyanosis. He said tet spell. Tet spell means cyanotic. A time of crying, the baby have cyanotic. Tet spell is the question of final exam also. 4 defects we have: right ventricular hypertrophy. Tet spell means in the time of crying, feeding, the baby should be cyanotic. Why? Because your activity increased and you need to blood flow more from lung, but you have a stenosis in pulmonary artery. You have decreased oxygenation. Because of it, you have tet spell attack. Tet spell means cyanotics in lips and fingers more than normal. Okay, do you find BSD, ASD, and all of things overriding of our? Okay, no problem? Final exam question. Which one is related to tetralogy of Fallot, or which one isn't? Pay attention. Remember these 4 signs. You can see here also overriding of aorta, VSD, pulmonary stenosis, hypertrophy of right ventricle. They have clubbing. Do you know what is clubbing? Okay. This is because of cyanosis led to clubbing and hypoxic tet spells. Hypoxic tet attack or spells because of hypoxia. This is like clubbing. Clubbing in the tetralogy of Fallot is more common because of hypoxia in the long term led to changing the appearance of finger. Yes.
Like a devil's.
If you went to pediatric wards in heart disease especially, pay attention to these signs. Complication. Tetralogy of Fallot is more dangerous and led to death because number 1, emboli. Why emboli? The hemoglobin in tetralogy of Fallot is more than 20. Why?
Because
Why?
lose oxygen.
Oxygen. You have hypoxia and the bone marrow try to produce more hemoglobin. Okay, and hemoglobin goes up and led to embolism. If your hemoglobin is high, you have hemoglobin, high hemoglobin, no hemoglobin megaly. You have
I mean, the megaly or calcitonin or the mortality of high level of hemoglobin.
not say megaly is not acceptable here. We have raised of hemoglobin. Increase, raising is better statement for them. Hemoglobin increased and your hemoglobin increase led to embolism. Okay? Clotting happened and led to embolism. Seizure. Why seizure?
Because the brain doesn't reach enough oxygen.
Oxygenation. Hypoxia led to seizure. low consciousness because of hypoxia, and sudden death. Sudden death means
Death of the brain.
death of the infant.
Yeah. Of the brain.
Suddenly death. Why? Hypoxia. Hypoxia led to brain death.
Yeah.
And because of it, this complication is very, very important and led to the death. Very, very serious. In the other countries, in, for example, London, we have a doctor that's name is Shamshir Saz. He is a surgeon in pregnancy period.
Yeah.
You know?
Tajallis
You have?
mentioned him.
Okay?
Yeah.
In Arab,
No, Dr. Tajalli mentioned him. That he is an excellent professor, surgeon.
they do in pregnancy period operating surgery for a mother in the and try to correct heart disease disorder, congenital heart
And
disease.
he go outside Iran. Leave.
Yes, yes. All of brains go out, and also for our country, we had a doctor that's Shamshir Saz, and she has gone to London and do surgery for fetus. In pregnancy period, he done some of
That's
these.
this complication happen in one time, and also should be all this complication happen or just
Maybe one of them. All of them are dangerous. Seizure is very dangerous by itself. And maybe happen all of them, maybe one of them. All of these things is dangerous, led to death. You are a nurse and you detect in Iran, we have many centers that we say health nurse home, that many of these neonates diagnosed by nurses. You are a nurses also in your country, and you are the first step for detecting. The infant come to your clinic and you see cyanosis, okay, clubbing for example, hypoxia, tachycardia, tachypnea. You said, please go to the doctor's office and see and detect congenital heart disease. The first step for diagnosis of congenital disease are you, nurse, you as a nurse. Very, very important that pay attention. In America and Canada, we have a practitioner nurse in congenital heart disease. And also we have, for example, echocardiographic nurse. Some nurses that do specialists about pediatrics, about doing echocardiography. And some of them are specialist sonography, for example. These are specialty in the other countries, and if you wanted to continue and you have money, you can go to continue your education in that countries in special field. Some of the universities give you fund. You can go free to learn in some of these countries. If you love, you can go.
But here in our country, they said this is not your responsibility.
Yes, and also for my country too. But in the other countries, they have specialist nurse.
Also, if you get a certificate,
Yes.
they will not accept it.
Yes, but if you go to America, you'll be as a specialist in the, for example, echocardiography, in heart disease. You can do all of these. You can prescribe drugs for patients also. And the treatment is oxygen because they have hypoxia, morphine for decreasing pressure, and the other thing is surgery as soon as possible. Surgery is the treatment, And something that's important is putting in squatting position. Do you know what is this? Squatting position is this? It led to decreasing cyanosis in tetralogy of Fallot. It is a final exam question also. What is squatting position? The patient putting in this position led to decreasing cyanosis because of increasing. What?
How much oxygen should we give the patient?
The patient with congenital heart disease try to put saturation above 87. It doesn't go more than that because they have a stenosis. Do you find it?
Yes.
This is children that they have squatting position. Then you can see blue and you can see the squatting position. What is this? Please see. Okay, you have pulmonary stenosis. Sometimes the patients go to angiography. Angiography, that is a closed work. Go to the angiography and the doctors go with a catheter, put a balloon to dilation. Okay? Pulmonic valve. Everywhere you have a stenosis, the angiographic doctors go and can put a balloon. It's not for a long time, okay? They try to dilate the place and go out, okay? It's not put it here for many times. It is only for dilating and goes up. This is the method that's balloon dilation of pulmonic valve. To increasing oxygenation, we can do it. You find this is a baby that is under oxygenation, and the baby have maybe some congenital heart disease. This is squatting position or decreasing hypoxia. This is a baby in the squatting position for decreasing hypoxia in tetralogy of Fallot. Pay attention. If in final exam you see ASD, VSD, PDA, that was acyanotic, and this method used for cyanotic. And something that's very important is in radiologic, in chest X-ray, they have a heart like a boot. Do you know what is boot?
Yes.
Boot, okay? You can see the heart like this. Boot shape is related to what disease? Tetralogy of Fallot, especially tetralogy of Fallot. You can see boot shape heart is related to tetralogy of Fallot. That is a cyanotic disorder related to congenital heart disease. Boot shape heart. That is a boot shape heart. Boot shape heart. And do you have any question about tetralogy of Fallot? You as a nurse in Baghdad, in Nasiriye, where is Nasiriye? If you are absent, I missed you because I couldn't say about your hospital. This is cyanotic. You as a nurse should do detecting and nursing care of them and pay attention to operation room and after operation room. They,
Post-operative complication.
what?
Post-operative.
What's operated for this? They are VSD. I said about treatment. They are PS. I said about balloon and VSD, balloon and overriding of aorta. That is a open heart surgery. That's too hard, and many of them expire.
Yes, I mean, post-operative. We ask post-operative giving a care for a complication.
Yes. This is special nursing care. They have very advanced mechanical ventilation. In ICU lesson, the teacher said about open heart surgery and caring of them. Okay? Pay attention, no problem. Only as a nurse, a pediatric nurse, detecting after operation room, you check some caring for them. That's very important. Checking, for example, ABG, ventilator, and sometimes they have dialysis, okay, peritoneal dialysis. These are super specialty that some nurses goes and train about open heart surgery ICU. Pay attention. In Baghdad also, and also in Nasser, and also in the other hospital. If you wanted to work as a nurse in ICU open heart surgery, you should go and train about them. We have the other, what?
He say, can you come to another slide?
Another slide. This one.
Before that.
Yusuf, give me your advice. This one? Foot shape is kind of congenital heart disease, tetralogy of followed. The exam question.
They say this is 1.5.
Maybe you are. Is it Yusuf have congenital heart disease in this age?
No.
Or tetralogy of followed?
Yeah.
Maybe if
Maybe
you
the
have,
shoes in his house.
you were expired up to now. Are you agree? Congenital disease like tetralogy of followed is a serious. Okay. TGA. What is TGA? TGA means transposition of great vessel. It's not my lesson, it's not my topic, but I wanted to show it you. If you go for trained nurse as an open heart surgery nurse, learn about it in brief. TGA, transposition of great vessels, great arteries.
Yeah.
How many great arteries you have? Awesome.
A lot.
A lot? You have a lot? Great.
4. 3 is
Great.
Pulmonary artery.
Pulmonary artery and aorta. You have only 2 great arteries. Except Mohsen that have more many.
I'm a rich
All
man.
of us.
I'm a rich man. I have a lot of great arteries.
All of us, we have two long arteries and big arteries. Number 1 is aorta and number 2 is pulmonary artery. What happened in this picture? What did you see?
We have a PDA.
PDA? Okay, we have PDA also. And
Between the artery and the
aorta goes out from, in normal position, aorta of you is here or here?
in the left.
In the left. Can you see aorta in the left in this picture? No. It's in the right. What about pulmonary artery?
It's in the left side.
It's in the left. It is normal.
No.
This is transposition of great vessel. What happened?
Immediate death.
There. The blood that goes to your body is cyanotic.
Yeah.
This is a cyanotic disease led to death. Only read and remember it. It's not my topic. I said to you, because of you here, TGA, transposition of great arteries or great vessels. Not more than, you have only two great arteries. Something that is not my topic at the end, I wanted to say to you is coarctation of aorta. What is this? Aorta. Coarctation of aorta means narrowing some part of aorta. What is this?
That's when they use some kind of a heating method. Heating method.
This is your aorta. Could you show me narrowing place?
Yeah.
Where is it?
It's there.
It's
Is that in the right?
Okay. What happened? Aorta is
enlarged.
narrowing.
And the other part is enlarged.
Why? What happened? What do you think?
Coagulation.
What happened? Did you have narration? What happened?
The blood will flow back to the right, to the left ventricle
Okay.
and atrium. It's lead to enlarge.
This is coarctation of aorta. You have a narrowing in the arc of aorta, and the pressure okay? The pressure in the upper is increased. What your idea about a pressure in the limb?
Is decreased.
Decrease. Why?
Blood.
Because of the
Narrowing. Pay attention. I said we're checking blood pressure in 4 limbs for neonates. Why? Check it to detect coarctation of aorta, okay? The pressure in the upper limb goes up and in the lower limb decrease, okay?
To come have noise in this situation when the aorta like explosion.
It is an emergency situation. Maybe the pressure in the brain branch goes up and led to hemorrhage in the brain. That is an emergency situation. What do you think about treatment? This is not my topic. It is also show to you that you remember we have this disease also.
Surgery.
What do you think?
Surgery.
You can put number 1 balloon for dilation. Everywhere that you have a stenosis, you can do balloon for dilation. And the other,
stent.
a stent also. You know, a stent, what is this? And yes, and also surgery.
Yeah.
Surgery, okay? The doctor goes and cut this narrowing place and anastomose 2 parts to each other, okay? This is also a serious disease, heart disease, congenital heart disease, and led to hypertension and sometimes very harmful and fatal for
Also deoxygenated of the lower limb.
and the oxygenation. No, is it
Of the
a,
lower limb.
pay attention, is it a cyanotic disease or acyanotic? Why cyanotic?
Because the blood flow will be decreased.
Yes, in the
We
lower.
said about cyanotic and acyanotic what? If you increase
The pulmonary.
pulmonary artery, is it aorta?
We don't.
Doctor, it's also cyanotic maybe happen in the limbs, not.
No. No, we didn't have cyanotic. The blood try to goes up to the limb. They are pale, not cyanotic. Pale, not cyanotic. The blood pressure goes up in the upper and decrease in the limb. It is not a cyanotic disorder, cyanotic heart disease. This is acyanotic. Okay?
Doctor, does it lead to
In the eye, no. Especially, you can see this. These branches go to brain. Something is very, very important is high blood pressure in the brain and rare situation maybe in the eyes, but not in the eyes especially. Especially the pressure goes up in these branches that go to the brain, and high blood pressure is led to hemorrhage and led to death. Pay attention. Detecting in coarctation of aorta is very, very important.
And also, does it lead to enlarge of the aorta?
Dilated it?
Yeah, the parts before.
Yes, in lifetime maybe, but it's these children are very, very serious position. They didn't let to get them lifetime. It's an emergency. Okay, maybe in the lifetime you have hypertrophy, for example, in this. You can see coarctation of the aorta in this picture also. We have many congenital heart disease that's not common and that's related to our topic in this class. If you wanted to go to continue as a practitioner nurse in heart, you can go to them. We have many of these diseases. Coarctation of aorta, you can see, and finished. Do you have any question? Congenital heart disease are very important for you as a nurse, and try to say to you to simple form that you remember them all of times, because you have newborns in your clinic, in your hospitals that comes to your clinic, and you as a nurse are the first step for detecting these congenital heart disease. For TGA and coarctation of aorta, only listen to them, hear them if you love. But the other things in my subject that I explained about them, nursing care of them is pay attention at the first to detect them and be careful about oxygenation, about their seizures, vital signs, as I said to you, is very, very important. And in CCU and ICU, again, the doctors will say to you about, for example, the sign and symptom of hypertrophy of ventricles and hypertrophy of, for example, atrium, and arrhythmia, murmurs, and it's not my job. In my subject, it isn't, okay? Only something that's important I said to you.
What about the final exams?
Final question. These are, I said to you. I said to you in every session, I said to you my question. What? How many the question about 40 for me and 20 for Dr. Tajalli? Maybe because
40, doctor?
for me about 40 MCQ, and for Dr. Tajalli about 20 or 30. Okay?
It's a case study or just a clear question? It's a case study?
All of them, both of them. For Dr. Tajalli also, she loves case study, but I love to some points that I said to you, and also case study. Please read the files. If you have any question, ask me, and I have class with you again. Do you have any question? Yes. What time is it?
10 to 11.
You have time?
Yes, we have
Okay. Please read Iron Walker. Where is Walker? Walker, please Send iron deficiency anemia. Read my files because Dr. Etedal said to you, and I don't have time to get them again. PDF files, and I wanted to go to this. I tried to show to you the disease of pediatrics with picture. What is this? This is a kidney. This is stone. What is this? Mohammed, what is this?
Excuse me, this is kidney stone.
This is stone. Please clear the smoke of your eyes and say to me what is this? Hashem, what is this? What are you doing? Okay, great.
That's lymph nodes.
What did you see here?
I think fibrosis.
Fibrosis, you can see a kidney
It's
and a mass on it. Okay?
This tumor.
Yes. When you see stage in my picture, you think about cancers. Okay?
okay.
Stage 1, stage 2, stage 3, stage 4. Okay? Could you explain for me stage 1? Stage 1. What did you see?
The tumor is small.
Okay, compare it with number stage 4.
Stage 4.
Hashem. Look at it.
Spread in everywhere.
Yeah.
What's the difference between stage 1 and stage 4?
Small.
Beta cells.
Big.
4 is
Step 1 is small.
small, the mass is small,
Bigger.
and stage 4?
Large and reach to the vessels.
Yes, metastase. We say metastase. Okay? You know what is metastase?
Yeah.
Spreading tumor to lymph node. Above number 3, stage 3, what happened? Zainab,
It's come to the
what
medical.
about number 3, stage 3?
At the stage
Could you say to me stage number 3?
the tumor is enlarged and it's reached to the bloodstream and then spread.
Vena cava you see. What's vena cava? You see vena cava.
Yes, superior vena cava.
Metastasis to vena cava.
Yes.
Something that is important is something that is important that in pediatric cancer is a disaster. Are you agree? And also metastasis. Vena cava is dangerous. If the stage of cancer goes up, the danger is more. How you detect about cancers?
Clinical manifestation.
For example, kidney.
By biopsy.
X-ray.
Biopsy or X-ray.
MRI.
For example, you have a baby that's your baby have, for example, this tumor.
Okay.
You as a father, how you find this tumor?
By palpation.
What?
We can see the black thing.
Yes.
All
As a mother,
When I opened the diaper, it's dry, not
you say my children has a tumor.
No,
you
No,
say that
it's
there's a problem. So there is either blood in your
Maybe in
or
the stage, for example, 4. In generally, the mothers find the tumor. The detector of these tumors are mother and nurses. Enlargement,
Excuse me,
okay?
doctor. The mother has X-ray or what?
Okay, what did you say? The mother is the best doctor. You know, They didn't have anything, not echocardiography, not chest X-ray. The mother says, I touch a mass in the abdomen of my children. Okay? The mother and also nurses in vaccination, for example, see a mass in the abdomen.
Yeah.
In the stages, for example, 3 or 4, you can touch it. The mother said, I touch a mass in the abdomen of my children.
So what about stage 1 and 2?
What about stage and 2? This is smaller, this is bigger. Only the size.
And in two large or one kidney?
Pay attention. Stages is related to choice for treatment. The choice of doctor's treatment for stages are different. Drugs are different. For example, drugs for number 1 and number 4 are different.
Yeah.
Pay attention. What is the name? What's the name? Is Wilms tumor. Wilms. Do you hear?
Yeah.
Where?
When, in one hospital.
No.
In the
Not
hospital?
patient, but head nurse asked us what is the name of a tumor in
Okay.
kidney.
Okay.
I'm going to Google and research.
Okay.
This name was
Pay attention. The most common tumors in kidney in pediatric is Wilms tumor. The mother or nurses in vaccination clinic detect it. Fathers know. Fathers are on company of meat. There is a company of meat.
He's not.
Mustafa, these are fathers of our children. We couldn't find fathers anywhere. Not detecting any disease, not pay attention to children. Is it in your country?
Providing financial.
Our problem is with our husband. Are you angry? Are you agree?
Yes.
No.
Yes.
No?
All catastrophes are because of
not
women.
all of the men was.
Okay, not all of them,
No,
but
excuse
most
me,
of
doctor.
them.
The name of the tumor is a man's name. So a man found this kind of tumor. And not a woman.
Yes, this is a doctor.
Yeah, a
This is
man.
a doctor, but generally, Wilms tumor is a malignant kidney tumor that occurs mainly in children. Most common between 2 to 5 years old. Wilms tumor is in children, not in adults. Pay attention. Wilms tumor. This is a tumor in kidney that's name is Wilms. Okay, fathers? Wilms tumor.
Doctor, when we do surgery to remove this tumor,
I will say, okay?
can separate just blood or anything from this tumor and place and regrowth in place of the body?
Yeah, I will say. The cause, what's the cause?
Mutation.
Mutation. The mother asks you, what happened for my children that my children have Wilms tumor? You say
It's because of her genes.
unknown and genes is responsible for all of your disease, your specialty, your color of your eye, your ear, your body, your head, your weight, everything that you have, these are genetic from your mother, your father, your family.
Yeah. So we can't control anything because our genetics
Yes.
are controlling us.
We couldn't control all of things, but we can control our marriage, not family marriage. It's under your control. Okay? Mutation, pay attention. Unknown, we didn't know mutation. This is cancer, and you have a grow fast and mass in the abdomen. Is it in left or right or bilateral?
Left.
Maybe happen,
Maybe less, maybe right.
maybe happen one of them.
Can it happen in two of them at the same time?
Yes, maybe. In many times it's in one and metastase maybe to the other one. But it is common form is one lateral. Look at the lymph tumor again, and you have metastases in the lymph node and vena cava. What the signs and symptoms? What do you think?
Smooth abdominal
It will affect on adrenal gland of the
Adrenal is affected. Pay attention to that picture. Where is your adrenal?
It's above
the kidneys.
Here, okay, and metastasis in this position, and we didn't have more adrenal involvement. Pay attention.
Can't produce erythropoietin. That causes anemia.
Great. Number one, you touch abdominal mass.
Yes.
The mother said, I wanted to clean my baby and I found that mass in the abdominal. Usually on one side, maybe bilateral. Distension. What is distension? Abdominal distension. And hematuria. Why hematuria? Because of tumor. Maybe you have hematuria. Maybe you have increase in renin. It's rare, but maybe anemia. Why anemia?
Because
Maybe hematuria. Maybe that is a cancer led to anemia. Fever. Why fever? In cancers, you have decreasing immune system.
Yeah.
In all of cancer, your immunity decrease. Weight loss or poor appetite. Why? Because of anemia and led to weight loss or poor appetite. Diagnosis? Sonography, CT scan, MRI, pathology. What's the treatment? What do you think? Yusuf, what's the treatment? You come from there to this part. Okay, what's the treatment? Every movement in this class means that I ask you a question. What's treatment?
Use of thighs.
Mahdi, what do you think about treatment of lymph tumor?
surgery.
Surgery and
They are remove the kidney.
kidney
And the stage 1 and stage 2 before.
based on a stage. For example, if you are the stage 1, is it acceptable that we remove kidney?
Yeah.
Maybe chemotherapy also.
Chemotherapy, surgery, for example, in stage. And if you have, for example, a stage 4, you can do surgery and chemotherapy with each other. What? Yes. In metastasis to vena cava, the doctors maybe not cut the vena cava. You can do radiation, chemotherapy for them. Okay? Detecting is very important. Okay. Do you have any question? No. What time is it? 11. Okay. Okay. Mahdi, what did you see? Do you have any question about these two before? Heart disease? Okay. What do you see?
I don't know
What is this?
abnormal.
This is colon and that one is ileum. You know, where is your ileum? Could you search your intestine in your cell phone? Ileum, jejunum, duodenum, colon.
It's the end spots. The distal part of the
Okay. What happened in this picture?
It's opposite. It's come to the.
Other.
It's gone side up.
Is it possible that one part of your intestine system goes to the other side? No? It is happened in pediatrics. It is happened, you can see the picture. What happened in this picture? Ileum goes to the why? Why your ileum goes to the colon?
We don't know.
God's
No.
Why hungry?
Contact.
If you are hungry, one of your intestines goes to each other. What about Nasser? Is it possible that a baby colon goes to colon, ileum goes?
That's what you're not saying.
This is congenitally? No, that's not congenitally. That is acquired. Not congenital. Not congenital. It's acquired. From? I will say. What's the name of this? What's the name? Ileum goes to colon. You say ileocolic into susception.
Yeah.
Into susception. The name is hard for pronunciation, but remember, this is very, very common surgery problem of pediatrics. Into susception is a medical emergency.
Yeah.
If you some parts of intestine goes to each other, that is an emergency situation.
Yeah.
One part of intestine slides into adjacent part like a telescope folding into each other. Like a telescope. You see?
Yeah.
Telescope goes to each other, two parts. This is into susception. It's led to bowel obstruction, blood supply to intestine decrease, and led to gangrene. Do you know what is gangrene?
Yes.
Necrosis, and led to death. That is emergency for your children into susception. What is this? Into susception. You can see this type, that is telescopic into susception. Common symptoms is sudden, severe pain. The baby comes to emergency bottle with crying more. The mother says, for 1 hour my baby is crying. And the abdomen is distended and vomiting, and final exam question is bloody current jelly stool. They have a special stool that is too beautiful, and we say current jelly stool. Because you have obstruction, because you have inflammation, led to bleeding. Question final exam. Body jelly stool, bloody jelly stool is the sign of what disease? Intussusception. Lethargy or extreme tiredness may be happen. Lethargy because of bleeding maybe happened. We are speaking about intussusception. The cause is it genetic is responsible? No, this is acquired, not genetic disease.
Acquired from
Doctor accident or what?
I will say idiopathic. What happened? Idiopathic. Maybe the baby have a polyp in the intestine, and this led to these parts of intestine goes to each other. Sometimes some infection. For example, a common cold the baby has. After that, intussusception happened. This is not congenital. This is acquired because some reasons that we didn't know. Idiopathic means we didn't know. Many factors may be affected. The kinds, number 1 is ileum to colon. Can you search about intussusception in your cell phone? Intussusception kinds.
Yeah.
Number 1, ileocolic. Ileum goes to colon. Number 1.
Yeah.
Search it please in your cell phone. Search it to see and confirm this form of abdominal surgery that is emergency. Number 1, ileum goes to colon as I showed to you. Number 2, ileum to ileum. We say ileo-ileal. This search that?
Yes.
Rectal and stomal intussusception.
Yes?
And intraenteric appendiceal and
Search the kinds also. Ileo-ileal. Picture especially.
ileocolic or
Okay. And also we have two parts of ileum goes to each other. Ileo-ileal.
yes.
Yes.
You see picture? Bombay?
Yes.
Yes?
I don't have internet, so I
He
can.
have internet. He's lying. He have internet.
It's just half an hour and it's finished.
Why somebody have internet, somebody doesn't have?
And there are
That's my subscription.
It's not free.
Ileo-ileal. Jejono-jejonal. Could you search?
What?
Jejono-jejonal.
The most common
Jejonom goes to jejonom. You know the odenom, jejonom, okay? Jejonom goes to jejonom. Jejono-jejonal.
You guys speak about small intestines.
Yes, so,
Yeah. So
what?
you guys speak about small intestines. Tell me about small intestines.
I will give you some tests about intussusception.
Okay.
Each kind, you know, think about that and see the picture. Jejono-jejonal, okay? Jejonom goes to jejonom, okay?
The most common type of intussusception is ileocolic.
Yes. But sometimes we have these types also, this red. Which one is common?
Ileocolic.
Ileocolic that I showed to you. Jejono-jejonal. Diagnostic test is for confirming is sonography and X-ray, maybe do. And the treatment, what did you think? Could you explain it for me? Surgery is invasive. The doctors try to do the other things that we say,
Air or thrust.
air or contrast, push to the. I say to my students, intussusception is like these gloves, you see, in hospital gloves. One of them, of these, for example, fingers goes to the other one, okay? To the, this, oh, here, okay? They pushing air, what happened? Because it goes out, okay? This part that had gone to comes out by pushing the air in the enema. in radiology, the doctors push the air from rectum to the intestine and let to comes out, and treatment is this at the first. At the first, treatment is air or contrast enema. At the first, air. If it is good, good. If not, at the second step, barium enema. They push barium, its lead to goes out. It's part of intestine. Enema. Yes, number one, air. Number two, enema with, for example, barium. Barium enema. Okay? And if it's not fixed, the surgery is emergency for them. Okay? At the first, we didn't do invasive procedure. Air enema is, or the first one.
First line treatment.
Yes, pay attention. Final exam question, air or contrast enema for treatment. Surgery may be needed if this enema doesn't work. Pay attention, these are very, very important. Into susception means ileocolic is more common. Do you have question?
No.
That's too easy. I try to explain for you that you know.
Doctor, does this happen in adults?
Adults, no, that's rare. But it is common into susception for pediatrics. You can see normal bowel and into susception. You know the length that's happened is very important. Sometimes this is short, sometimes this is long. Two parts goes to each other. That's very, very serious situation. Led to necrosis, led to bleeding, and led to death. The surgeon goes to the operation room and try to pull them out of each other. You can see. Maybe after surgery happened again, recurrent. Is it possible?
Yes.
Yes. Maybe goes to each other again. This is surgery for these children. The common form is ileocolic. Final exam question. Which one is the common form, Muhammad? Which one is common form? Ileocolic. Ilo goes to colon is the common form. This is telescopic, going intestine to each other. The length of into susception is very important. Sometimes it is short, sometimes it is too long, and the complication is more. The baby is crying, for example, 20 minutes crying too loudly, and after that stop, and again start to crying, and distension of the abdomen is very important. Pay attention about pain, about distension in the abdomen of pediatrics. Sometimes that's emergency. We have in the surgical ward of pediatrics, we have many of children that is missed. For example, the baby had pain in abdomen. The doctor said, for example, prescribe for them some acetaminophen or drugs, and the appendix is ruptured. And after that, they operated children. They are missed. Many of them missed and led to some complication. For example, if your children is crying, you try to calm her with some drugs, and it's hidden the disease and led to rupture. If you go to surgery wards, you can see some of these patients that's missed. Barium enema, you can see that is barium, and they pushed by force enema in the colon and rectum and try to correct the situation. If not, the surgery is recommended, and you as a nurse monitor abdominal pain, crying, stool, checking stool, pay attention. Ask our mother about bleeding in the stool, that is because of gangrene, because of under pressure. Checking vital sign, tachycardia, fever, level of consciousness, lethargy, abdominal distension, tenderness. Monitor intake and output is very important for you. But you as a nurse, for everybody that have a problem, at the first step, check vital sign. It is very important. If your baby have fever, maybe some infection happened in this. Tachycardia, very important for these patients, and also blood in stool. Example for final exam. What's the answer? Related to translated, pronounce it. What was? Into susception. Repeat, please. Repeat after motion. Repeat, please. What? Muhammad, correct. Intrasusception. Is it correct?
No.
What is it?
Intrasusception.
No. Susception. Translate again.
Deception.
Into susception. you have. Pay attention, increase your knowledge, your experience. If you go for internship to all of us, try to learn more and more from
Don't
nurses.
allow for the another person that maybe laugh
If your knowledge is decreased and you have deficit knowledge, some doctor says to me about my students. They are high level, they are low level, and they judge you. Try to learn, try to...
Doctor, can we take a rest? It's now
Yes, do you
11.
have any experience about laughing doctors at you because of knowledge deficit? No? You are good students, thank you so much. What time is it? Okay, food ceremony is in what time? The 12? 12 start? Okay, ask about, I said to me the time. You get